Hello, this is Dr. Martina, your online sex therapist and sex educator. Last week I created a learning video about anxiety's prominent role in our sexual experiences, or lack thereof. Please review that part 1 of this series called Sexual Anxiety by clicking to the link that I will provide at the end of this video. This week, as promised, I will introduce you to the exercise called Sensate Focus, which is something that is being used by a lot of sexologists to help clients combat sexual anxiety. Most of us have grown up being out of touch with our bodies. Unrealistic messages about what our bodies should look like separate us from knowing what our bodies feel like. No wonder anxiety is one of the main causes for sexual problems, because how can we heal our sexuality without knowing what our body feels like? But thank God we can learn it. We can learn to reconnect with our body's feelings with the ability to give and receive touch. Touch has healing effects. There's been many studies that have proven that. We're not sure what really and how this healing occurs during touch. I've asked myself that many times, and I'm wondering, could it be that touch directly promotes calmness? That it infuses caring? That it promotes self-worth? Or that it communicates that we're being loved? Or that we expect everything to be okay? My guess is that it's a combination of all of these. But the one thing I know for sure is that an intimate sexual relationship offers excellent opportunities to experience the healing powers of touch. Masters and Johnson was a research team of the 50s who pioneered the nature of the sexual human response. Through their studies, they learned that anxiety is the main reason for sexual problems, and that healing touch is the best way to identify and overcome anxiety during sexual encounters. So they developed the exercises called Sensate Focus. I know it sounds a little clinical, but it's very clear in what it means. It is the focus of sensation. It is a particular kind of sensual touch, and it is a particular way to apply such touch. What they call it a touching and bonding exercise between partners, but it can also be an exercise that you can do for yourself and by yourself. Sensate Focus requests a specific touch. It's a caress, it's not a massage. It is a very slow caress done for the toucher's pleasure. Sensate Focus requires focus. Focus on the touch. If you're passive, then you will focus on the touch that you receive. If you're active, then you focus on the touch you're giving. So the benefits are for both the toucher and the touchee. Remember, we're dealing with anxiety, so the beginning needs simple training to relax so we can move from the SNS, the fight or flight nerve system, to the parasympathetic nerve system, the digest and relax. So this exercise, it's important to remember this, is free of psychological pressure. It is focus, it's in the here and the now, it's relaxing, and it is sensuous. I can't emphasize enough the importance of slow. You and your partner will feel much freer to relax when you take it slow, when you close your eyes, and when you don't talk. You cannot caress too slowly. Keep that in mind. If you have a sexual problem, you associate sexual activity with the bodily changes produced by anxiety. You associate sexual activities with shortness of breath, with lack of focus, with not being able to feel anything, and with high muscle tension. If you do Sensate Focus exercises by yourself or with a partner, you will learn how to remain focused, how to remain calm, how to check on your muscle tension in your thighs, how to implement a good belly breath so you can remain relaxed and stay present. You will learn all of that with Sensate Focus exercises. You will learn how to combat anxiety during sexual activities. So this brings me to the end of part 2 about sexual anxiety. And for next week, for part 3, I will go over some specific Sensate Focus exercises with you, step by step, so you can do those at home and you can start implementing this amazing tool to combat possible sexual anxiety that you or your partner experience. I will see you next week.